This is COMD 400 Hearing Science. This is a lecture on temporal bone, part 2. This particular lecture starts here at slide, not shown here, but this is slide 18 in your lecture slide set. And this will go from slide 18 to slide 30. This part 2 could be subtitled Holes in the Temporal Bone, and this covers study questions 43 through 49. So some basic terminology. A hole is just not simply a hole. There are different versions of holes through bone particularly, so we need to sort of define a few of these just to make it easier to kind of recognize them as we need to. So we can talk first about what are called canals. Canals are narrow tubes or channels through bone. There's also a word that sometimes is used, particularly in the context of the external ear, which is this word meatus. Very often we see that these two words are kind of given as equals. However, and for our purposes, we'll continue to do that. Strictly speaking, for me, the meatus is more or less the external portion of the passageway, but your authors, particularly Cycle, seems to use them equally and interchangeably, so that's fine. We'll just kind of go with it. So holes through the bone. So if, a reasonable size hole through bone is a canal or a meatus. Now, foramen, with the plural foramina, is a much smaller hole usually that typically allows nerves or blood vessels through it. So there are many foramina in the cranial skeleton that allows all the various nerves and blood vessels and such to go through the cranial skeleton to and from the brain and so on. There is one, however, one really, really big foramen in the skull, and that's called the foramen, and here's why we know it's big, magnum, the foramen magnum. Now, we already saw that on slide 16. I'll show it to you again here on slide 23. The foramen magnum is the hole in the base of the skull through which the brain stem protrudes inferiorly. So the foramen magnum is a very important, very large hole to allow basically your brain, via the extension of the brain inferiorly, the brain stem, to extend to the rest of your body. The brain stem ultimately becomes your spinal cord. So the inferior extensions of your brainstem, spinal cord, allows the central nervous system to go through all parts of your body. And that has to depart the cranial vault via the foramen magnum. We'll see it here in just a second. All right, so we talk about holes in the temporal bone, and I sort of use this term major hole number 1. The word major here, as I'm using it, is really only with reference to the auditory system. There are some other holes that are certainly very, very important. So when I'm thinking about this, is reference to the auditory system is what I really want us to kind of focus on. So that's really kind of my own bias on this. So major hole, major to me because this is part of the auditory system. So major hole number 1 would be the external auditory canal, or EAC. That's in the outer ear, and it's specifically in the tympanic section of the temporal bone. So external auditory canal. Another name that you might see for this would be also the external auditory meatus. And so the external auditory meatus, for our purposes here, for most of the authors, is the same thing. For me, again, it's the lateralmost part of the external ear canal, but nonetheless, many authors use this the same, and that's my big warning down here. And again, I'm not sure that this is exactly correct from a literal, interpretation of what a meatus is, but that's what people sort of seem to do. So we just have to kind of go with it. So external ear canal, external auditory canal is the hole on the side of your head, right side, left side, will be major hole number 1. And if we looked at it, this is not from the Cycle book, but again, a left I'm sorry, this would be a right lateral view of the skull. And again, here would be the, again, in this particular shot, remember, this purplish color is the temporal bone. And so the tympanic section here of the temporal bone is where the hole is. And so if we look at it, these authors even say there it is, the external auditory meatus, and they just point us right to that hole right there. Strictly speaking, the external auditory meatus, as we'll see when we talk about it in the outer ear, has both a soft tissue portion and a bony portion. Since we're looking here at the skull itself, we're not seeing the soft tissue because that's all been removed. You don't see the back part of the ear that you could feel if you just reached your hand up to your ear. This is looking at the bony skeleton of the bony cranial skeleton. And so there's a chunk of bone there. It's got a hole in it. That hole is the external auditory canal, or as I would prefer to call it, the external, as they call it, the external auditory meatus. I would prefer to call it external auditory canal. But there it is nonetheless. Major hole number 2, again, major, again, meaning reference to the auditory system, would then be the internal auditory canal, or the internal auditory meatus. And again, my warning still applies, is that this would be potentially used interchangeably by some authors. The internal auditory canal, we've already saw it. I pointed it out to you on slide 16. I'll show it to you on the next slide, 23. And again, this is in the petrous portion of the temporal bone, and in fact, it's the posterior facing and the most medial part of the internal auditory canal in the inner ear. Okay, so here we are looking into the skull base, and we've seen this slide before, the same slide as we saw on slide 16. So given that, let me get my pen back here. Given that, you see the indicators that I put for you here is the left, this is right. We're looking down, so this is anterior, this is the front. So these are terms that you should be getting more familiar with. Posterior, this would be the rear of the skull. And then looking on the right side. So remember, as we were looking at this particular model, this particular illustration, what you see here in purple would be then the temporal bone. And we're looking now basically at the floor of the skull. So in the third part of this temporal bone lecture, we're going to look more specifically at the details of the floor of the skull. But what we're interested in right at the moment here simply is we're looking at this section of the temporal bone here, which is the petrous portion of the temporal bone. It was sometimes called the petrous ridge or the petrous pyramid because it does have this kind of rise. It is a prominence. It rises from the flat, so to speak, of the floor of the skull bone floor. What we're interested here, though, is we're looking at the internal auditory canal, which would be this structure right there. So remember that what's underneath here is going to be the inner ear, and here's one on the other side. So again, you see that these authors identify this as the internal auditory meatus, or the internal auditory canal is what my preference is. Understand that as we're looking at this, there are two of these. There is an internal auditory canal on the left side. There it is. There is an internal auditory canal on the right side. There it is. Okay, so we've got two of those internal auditory canals, one on the left and then one on the right side. And again, the major feature of the need, if you will, for the internal auditory canal is to allow the auditory nerve, which begins inside of the petrous portion in the inner ear, to extend out and to cross, and it's ultimately going to insert into the brainstem. Now, this big hole here, as you see labeled, is the foramen magnum, and there's nothing in it in this particular illustration. But in a real brain, the brainstem would be in there, and at this particular point, the auditory nerve, which would begin in the inner ear, would come out of the internal auditory canal and join into the brainstem right at about this point. We'll see this a little bit more when we talk about the anatomy of the auditory nerve, but I wanted to kind of point out to you that that's what's happening. The auditory nerve on the right side would do the same thing and would go across the floor of the skull base to enter into the brain stem at this particular point. Okay, now other holes in the temporal bone that I want to comment on, and again, other here doesn't mean that they're not as important. So again, other is just, again, my way of defining it. So these are still very important holes, and as a matter of fact, these holes then particularly have more to do with blood vessels, is what I'm going to show you. So they're very important, but they're just not specific to the auditory system. They're important really more for the brain, but not specific to the auditory system. And so major hole, not major hole, but the other hole, number one, is the carotid foramina. The carotid foramina, again, there's going to be two of these, right and left. That's why it's plural. The carotid foramina are holes through the temporal bone that allow the blood vessel known as the internal carotid artery, right and left, to be able to go up to the brain. As you will learn in COMD 463, or maybe you've already had it or maybe not, but in COMD 463, which is our neuroscience class, you're going to get a little bit more about this. But the brain has three main cerebral arteries. And two of them, the anterior and middle cerebral arteries, come from the internal carotid artery. So the internal carotid artery runs through the temporal bone, right and left sides. So you got two internal carotids, one on the right, one on the left. And when it gets up to the brain on either the right or the left side, it becomes the left anterior cerebral artery, the left middle cerebral artery, and the corresponding things on the right. And so this is, again, a major blood supply to the brain, to the cerebral cortex. So again, a very important hole, just not necessarily key to the auditory system in that specific a way. Here's a picture again out of a book that I use by Temporal and Derrickson. I use this book a lot in my, and so you see TD. That shows those are the two authors. The Temporal and Derrickson book is just a basic sort of college level anatomy physiology book entitled Principles of Anatomy and Physiology. And you know, some of you, if you've had that kind of course, might have used that book. It's a very common, well adopted book. Anyway, you notice I put the heart in here. That wasn't part of the illustration because I wanted you to see sort of where it originates. And so you've got a big major blood vessel coming up, and then at this point you've got the what's called the right. In this case, we're looking at the right side. What's called the common carotid. Common carotid, and the common carotid then splits into two branches. One's called the external, and not surprisingly, then the other is the internal. And it's the internal carotid that goes up and goes through the temporal bone right about in through here. So you get a general sense about where that's going at that particular point. The external carotid is not really of much of an issue to us. It supplies blood to the surface of the face and skull and so on. But it's the internal carotid that sort of goes right underneath. Now, you know, we see the temporal bone here. Here's the zygomatic arch. Here's the tympanic portion. There's the external auditory canal. So we have a pretty good idea just by this view of this lateral view as to where the internal carotid is going in. We'll take a look at it here in slides 28 and 29 before we leave this slide set. We'll actually take this skull here and kind of move it back, and we'll take a look at the underside of it and see actually where those holes are. So there's the internal carotid, that, again, a major hole that's allowing blood to get up to the brain. Now, the other hole is also a blood vessel hole. This is now the jugular foramina, again, right and left side. So all that blood that we brought up to the brain, we're going to need to bring it back down to the lungs for a reoxygenation. So all that blood has to be recharged. So whatever we brought up to the brain, we're going to have to bring back down. And so there are blood vessels that basically drain the brain, and this is this internal jugular vein on the right and left sides. And so all of the blood that goes up gets through the internal carotid and other blood vessels. The brain takes all the oxygen from that and now sends it back out to be replenished. And so again, using the usual convention is to show arteries and oxygenated blood in red, and blood in veins, and veins themselves as blue, as deoxygenated. That's just sort of the standard. And so for our purposes, it really doesn't so much matter, but all of these main blood vessels that are in the brain all kind of come together to this point and becomes the jugular. And again, we can see that the jugular vein, as it's going down again to the lungs at this point, again, where is it? It's going through the temporal bone. Here's the external auditory canal. So we would anticipate that that hole is going to be also proximate to the carotid foramina, and in fact, that's what we're going to see here in just a second. So let's take a look at the underside of this structure and see what if we can identify these. So out of the cycle book, out of cycle figure 6-9, although not identified expressly, we can easily find them. We're looking now, if you have the orientation here, we're looking at the underside of the skull with, and again here the teeth would be here, okay? So the underside of the skull, so you could put in all your teeth like that, okay? I'm not a dentist. And again, for this particular view, the mandible has been removed. The jawbone has been removed so that we can see these structures. And so these foramina are not perfectly round necessarily, but they're of different sizes. But that's not really of much care or interest to us. But here's the external auditory canal there. There it is over there. And so what we said when we were looking at those other pictures on slides, whatever it was, 25 and 27, we saw that these were going a little bit, sort of to, next to the internal auditory canal. In fact, that's the case. So here's, in this particular case now, this carotid foramina being here for the carotids there, so that's the carotid, and then the jugular foramina sort of right next to it. And what's important to note is that this is the external auditory canal, and then essentially right above this, and it's, so I don't have the capacity to show you from this particular view, but immediately above this particular surface here would be what we call the middle ear. Remember, the external auditory canal is the outer ear, and this is the middle ear. So essentially then, these the carotid and the jugular blood vessels are like right next to, right around the middle ears on the right and the left side. And that provides some interesting possibilities for pathology. Again, here's just a photograph of the sort of the same structure we were looking at just now in a cartoon format. Again, here's the external auditory canal. Here's your carotid foramen right there. Here's your jugular foramen. Here's your carotid foramen there, and there's your jugular over there. So again, when you look at it underneath, they're fairly easy to identify if you know what to look for and where. And so that's generally how that works. And here's again the external auditory canal over there. Okay, that brings us to the end of part 2. Again, as a consequence of having viewed this video, I would hope that you'd be able to identify the major holes in the temporal bone. Those I defined for you as the IAC and the EAC, external and internal auditory canals. And the other important holes were the carotid and as well the jugular foramina. And again, those are important blood vessels for getting blood flow to and from the brain. All right, we're going to pick up it in the last section of the temporal bone lecture in part 3.